opportunity for us to talk to you. Just a sec. Thank you for the opportunity to talk to you about our paper. I would just like to acknowledge that I'm speaking to you from Treaty 6 territory and homeland of the Métis in Saskatchewan. And I will be presenting with Anne-Marie Edmonds and Tom Porter today, and Christine Stobart, who is also on the team, is here at the meeting as well. So I'm actually an associate librarian at the University of Saskatchewan, and my area of specialty is synthesis reviews. So I support researchers and collaborate with researchers on doing various kinds of large, comprehensive, and rigorous kinds of reviews. And of course, my area is the literature search part of that. I've also been involved in sort of researcher capacity development in conjunction with Skipper, which is how I became connected to this project. Anne-Marie is a busy grandmother, helping with and attending activities of her 5 grandchildren. And she retired a few years ago after 42 years of a nursing career. And Tom is a researcher himself. He's always pushed for strong participation from diverse perspectives, and he wants to contribute to healthcare based on his experience and his daughter's personal experiences. This project was funded by the Saskatchewan Centre for Patient-Oriented Research in financial terms and also in kind. So I'm going to start briefly by talking to you about how we assembled the team and how we worked together. And then I'll describe how we did our review of the literature and what we found. And then Tom and Anne-Marie are going to share their thoughts at the end. So as I mentioned, this project emerged as a result of a partnership between the University of Saskatchewan Library, and as I was the representative of the library, and the Saskatchewan Centre for Patient-Oriented Research, which I'll call Skipper from now on. And we had worked on a variety of researcher capacity development, particular activities and workshops, particularly in relation to a kind of synthesis review, which is a systematic review. And also with my colleague Angie Gerard, we developed a library guide to provide our researchers with somewhere to go to do a bit of self-directed learning for these kinds of really large-scale reviews, and also some resources. And one of the things that we wanted to add into that was some advice or guidance and resources about engaging patient partners in the synthesis review process. And we identified a need to review the literature on engaging patient partners in synthesis reviews. And we decided to do that really thoroughly, but we had some time constraints. So we chose what's called a rapid review, which involves all the usual steps of a review, but with some concessions for time. We also wanted to have patient partners assist us with this process and guide us. And so we decided on a patient-oriented rapid review. And at that point, we assembled a team. Our 2 patient partners, who I've just introduced, Anne-Marie and Tom, were recruited with the help of a Skipper patient engagement specialist. My colleague who I work with on these projects a lot, Angie Gerard, joined the team. And we also sought the involvement of 2 research faculty at the University of Saskatchewan, Brenna Bath and Donna Goodrich, and they had experience doing various kinds of synthesis review or knowledge syntheses. We were also lucky that the Skipper specialists, Kate Dunn and Christine Stobart, not only provided really extensive administrative support for the project, as well as financial, but they decided to join the team. And we started with a half-day meeting in September of 2019. The images you see there are actual images from our process, but not from that first day. We didn't get pictures on that first day. And we had 3 quite lofty goals. We wanted to provide all team members with some sort of overview of what a rapid review method looks like. What does it entail? And that was because only 3 members of the team actually had experience doing or conducting a review of that kind. We wanted to define the research question, and we needed to get to know one another because we had not met before or worked together. And the format we used, I'm going to describe because it's the same format we used throughout our review process. We did start with introductions and with sharing of our stories and our goals and aspirations for being engaged in the project. And then we moved on to hands-on examples of the methods. So actually working through how do you choose an article to include or to not include? What's that process like? How do you decide on the criteria? How do you know what information to pull out of the document when you've decided you're going to include it? So we work through all of the steps of a review using what I'm calling a discipline neutral topic, because we didn't share any disciplinary background at all. We had nurses and librarians and physical therapists. We all just came from different backgrounds. And so we decided to use a topic that was familiar to everybody and also slightly lighthearted. And so we used cookie recipes as our example. Once everybody had sort of a little bit of grounding in what it means to do a review of this kind, we had a discussion about the research question because we had a topic, but not a focused research question that we could answer in a rapid review. So our topic generally was around patient engagement in synthesis reviews, but we had to become clearer on what we wanted to know. We also socialized. So we had coffee at the beginning. At break time, we ate some of the cookies from those cookie recipes. We actually baked them. And then at the end, we had lunch, and that was also typical of our process. So we knew that we were interested in meaningful engagement, and we based our definition of meaningful engagement on a conceptual framework by Hamilton and colleagues that was published in 2018. And we would use that to inform our question. And we had 2 questions. We wanted to know the characteristics of a team that creates an interactive team and positive research environment that's conducive to effective contributions by patient partners. We also wanted to know how research teams can conduct their reviews to ensure planned, supported, and valued involvement of patient partners. And there had been some reviews on similar topics, but what we were really interested in was the patient perspective on these questions. And that was what we were bringing to the literature that was going to be new in doing our review. So here you can see an outline of the usual synthesis review process. And what I'm going to do is talk to you about what we did to make it a rapid review and how we involved patient partners and walk you through some of our results at the same time. So at the beginning, every team member agreed to participate in all parts of the review. And so everybody was engaged fully throughout. It wasn't necessary to participate at the same level at each step. So our first step after defining our question was to do a really comprehensive search of the literature to find documents that discussed patient engagement and synthesis reviews. We would review articles to make sure the patient perspective was represented in the next stage of the review, because it's very hard to pull that out using the lit search. So what we wanted to do was look for peer-reviewed articles, which are the typical articles that one would include in a review. But we were also interested in any reports that might have been published by relevant associations or agencies, and also other kinds of documents, including things like blog posts. So our criteria for what to include was quite broad in that sense. We searched multiple academic databases to find those peer-reviewed articles, but we also searched the tables of contents of a key journal, Health Expectations, and carefully selected websites. As a concession to this being a rapid review, we searched a smaller number of academic databases than probably is typical, and we were very careful in our selection of the websites that we searched. And we found 1,089 documents that might be useful to us. At this stage, that lit search was a nice coarse filter to get us down to a reasonable number of articles to look through, but we needed to select the relevant publications at this point. And we did this through a two-stage process. We first had two people independently look at each title and abstract and decide if it looked interesting. And then we did the same, but looking at the full text. And the criteria that we used are listed here. So we wanted the article or document to describe or reflect on patient-partner engagement in a synthesis review. And we were open to lots of different kinds of synthesis reviews. So it could be a systematic review, a realist review. It could also be a clinical practice guideline. So we're really interested in those that most typically are employed to guide research agendas. So something like a scoping review, or which can guide practice. So those systematic reviews and health technology assessments. We needed the patient partners to have had actually participated in the conduct of the synthesis review that they're reflecting on. And we focused on the meaningfulness from the patient partner's perspective. Okay, and I should say that at this stage, when we looked at the title and abstract, this culled the number of articles down from 1,089 to 55 that still looked of interest. We then reviewed the full document of those 55 for relevance, and of those 9 documents met our criteria. Okay, at this point, from those 9 documents, we extracted pre-specified information using a form that we developed and piloted. And we extracted 3 kinds of data. Descriptive data about the documents. So we were looking at who the authors were, the year the document was published, the country of the corresponding author, whether they had received funding, that kind of thing. We looked at descriptive data about the study itself. So what was their aim? How many authors were there on this paper, and how many actually were patient partner authors? What was the study design? What was the synthesis review team composition? And how did patient partners engage? We also extracted what I'm calling qualitative data regarding the mechanisms for patient partner engagement and training, and patient partner perceptions of that engagement. And the data that we were extracting were text excerpts from the document. And in some cases, there were, within the text, there were quotes directly from patient partners expressing their experiences. And in that case, we knew that that was the patient partner's voice. In other cases, there was a description of what the engagement looked like, or the experiences of engaging in the synthesis review, but it wasn't completely clear whose voice that was. And so what we found was we needed to code the text that we pulled out based on what we called voice. So was it the patient partner? When we had those direct quotes from a patient partner, we knew that was a patient partner voice, and it got coded accordingly. If it wasn't a direct quote, then we looked to see if patient partners were part of the author team, and if so, then we assumed that patient partners had some say in that quote, and so, or that content, and so we labeled that research team voice. Our last step was to synthesize all the information we extracted, and particularly that qualitative data. And so we did descriptive stats. We counted the number of the average number of authors and the average number of patient partner authors and that kind of thing. But the bulk of our time was looking at the qualitative data, looking for patterns or themes in that data using a process called Thematic Analysis, as recommended by Braun and Clark. And it was at this point that the pandemic was first felt in Saskatchewan, and we had to move to Zoom instead of in person. And all of the team was affected to some extent in their work and personal lives. And we wanted to keep the project moving forward in a timely fashion, but also recognized team needs and the desire to maintain good quality. And this process is quite complex and requires a lot of discussion. And so what we did was everybody on the team looked at the data and coded it. And I'll show you an example of coding in a second. And then we all had a deep understanding of that data. Then we moved on to a step where we engaged a unit on our campus, which is called Chaser. It recently changed its name, so I'm just gonna look it up. It's Canadian Hub for Applied and Social Research. And they have expertise in this area, and they were able to code and theme data for us. And that kept us on track and maintained quality. And then our team reviewed the coding and themes, identified some nuances, and then modified those themes based on that deeper understanding. Okay, so here's an example, a couple of examples of quotes and themes. So this quote you can see here was actually a direct quote that we pulled out from an article from a patient partner. And it was labeled with this code, patient partner benefit, reflecting the fact that in this quote, you can see that some of what made the engagement meaningful was that they were able to see the benefit of their work. And there were other examples, obviously. A second quote is provided just below that. And here you can see that the patient partner experienced a sense of accomplishment. And so this quote and others were labeled with the code sense of accomplishment. And together, together this was a pattern in the data that we thought reflected that meaningful engagement sometimes requires personal outcomes that are valued by the patient partner. So there were actually three themes that we found, the one that I just described, and they relate broadly to the research team, to the personal level, and to the research level. The first relates to how the team needs to work together to foster an environment in which patient partners can be involved meaningfully and perceive their involvement as meaningful. And there were sub-themes in this, this first theme here at the top. So the fostering of partnerships rested on appropriate training, on building supportive relationships within the team, being clear on roles within the team, and balancing the patient partner and research team expectations and opportunities with the available resources. As I mentioned in the previous slide, patient partners' perception of the meaningfulness of their engagement was also affected by personal opportunities. There had to be opportunities for outcomes for engagement in which the patient partner experienced a sense of satisfaction and accomplishment, and in which patient partners could examine their beliefs and expand their learning. The last had to do with the research endeavor. And meaningful engagement in this case rested on a team environment which enabled the patient partner to influence research priorities and to enhance research relevance and quality. So I'm just going to give some last thoughts, and then Anne-Marie and Tom will also give their thoughts. So the results of this review do expand our understanding of some of the realities of research teams who are navigating various unique contributions, skill sets and knowledge, and emotional impacts on patient partners with the available team resources and the time. We noticed that very few of the included studies incorporated the direct voice of the patient partner, but among those that did, there appeared to be parallels in the researcher interpretation of the patient partner engagement and what the patient partners experienced. So now I'm going to invite some thoughts from Tom first, and then Anne-Marie. And I'm going to stop sharing my screen now.